your muscles contract. So say you raise your eyebrows, you can see wrinkles, but static wrinkles are present at rest. So the older you get, the more likely you are to have static wrinkles.
But what we're trying to do here is trying to fight these wrinkles from forming in the first place, and the pathophysiology of that is by working on the muscles itself. The thing with Botox and fillers is it allows you to be artistic. So you have to always put across what you think the patient will benefit from, and then you have to hear what they say, and then you basically have to try and meet somewhere in the middle. Beginning 2007, not 17 in fact, the government worked together with BAPRAS, which is a British aesthetics and plastic surgery. It's a bit like the plastic surgeon's version of BALMS, which is their main sort of UK group, and they have an annual conference, and they have their own journal, and everyone sort of links into that. So they've come together with the government to say, actually, we should have a register. We're not saying aesthetic practitioners shouldn't be doing this work, but we should be evaluating what courses they've been on, how much training they've had, have they had a mentor, how many cases have they done, what complications have they had. And I think it's really important because your face is everything. You know? If your face ages, people get really worried, but imagine if it gets destroyed to a certain degree, that's bad. And what do people do? They look at Google reviews, and some people just go for where you can get stuff done the cheapest. And it's really dangerous. It's something that actually needs to be more heavily regulated, isn't it?
So it's quite kind of strange. The products on the market are so heavily regulated, but the actual practice of doing their techniques is not. Anyone can really do it. Like if they've had any treatment previously to this, and how did it go? Did they like it? What areas didn't they like? And it's important to look at their skincare regime, because obviously they need to be looking after their skin. And it definitely needs pre and post-op photographs for your consultation, 100%.
If you see yourself every single day as you do in the mirror, then you don't really see the changes. When you've sort of put weight on, or when you lose weight when you've been going to the gym, you don't really notice it. But if you see a picture of yourself now, and then 2 weeks later you go, wow, I think I've lost a lot of weight. It's the same with the face. People don't notice the changes. So it's really important to have pre and post photos so you can say, look, this is the exact changes that we've made. Hi guys, welcome to our Facial Aesthetics Day. I hope you've enjoyed yourself. I just wanted to have a small few minutes just to tell patients out there who are interested in this kind of work and want to have an increase in their sort of facial youthfulness and their confidence levels, that the most important thing is to make sure that you're confident with the person that you go and see, and that they're accredited, and that they have before and after photos of the specific work that you want to have done. And also that if they don't have any, then that should be a bit of a warning sign. And always ask for their accreditations, and they should have some sort of registered accreditation, and you can then Google it. Don't feel forced to straight away sign up to any long treatment plans.
So yeah, choose your practitioner carefully, but also make sure you have a list of questions that are answered fully before you start any treatment.